So our next guest, we're going to be talking about weight reduction and getting some group support around that. So we'll find out more shortly. So Dr. Sarah Jarvis, GP and broadcaster, and Kim Madison, who is going to give us an insight into her experience. We're going to look at weight reduction, getting support for it. Welcome to the show. Great to have you on board. Dr. Sarah Jarvis and Kim, can you give a bit of insight to the research, please, Doctor?
Yeah, absolutely. So this was research from Slimming World. You won't be surprised to hear it related to people who are taking weight loss injections, because it is so much part of the news at the moment. There seems to be a news story about weight loss injections every week. Now, what they did is Firstly, they polled consultants for Slimming World, and more than a third of them said that they've already welcomed new members who are currently taking weight loss injections. They then polled people who joined groups who were taking them, and there were some really positive findings, I think, which very much fit with the national guidance that's out there. So more than 4 in 5 of those people who were part of Slimming World, but they were still using weight loss injections, said they felt more confident they'll be able to maintain their weight when they stop taking the medicine. Really importantly, 9 out of 10 of them said that being supported by people who understand how difficult it is to lose weight was invaluable. And from a doctor's perspective, this one is really important to me too. More than 2/3 of them said since joining, they've learned how to eat a healthy, balanced diet they can stick to. Now, this is absolutely crucial because, unfortunately, weight loss injections can be very effective at helping people to lose weight. However, in the real world, rather than in the clinical trials, we find that more people who take the injections are coming off them. About half of people are coming off them within a year, often because of side effects. Of those who stayed on them, 4 in 5 people were taking low dose maintenance, which won't help lose as much weight. So they weren't getting the same level of weight loss in real world studies as they were in the clinical trials where they were provided with this wraparound care. But really importantly, and I think very worryingly, the majority of people had put on all or most of the weight that they had lost within a year, and certainly within 2 years of coming off treatment. And importantly, what the researchers found was that the rate of putting the weight back on again was much greater than what we see when people have gone on to behavioural weight management programs and have finished those. And that is why NICE, our national guidance, has come out and said that anybody who is taking weight loss injections, firstly, should have wraparound care, should have support, everything, just ideally check-ins, regular check-ins, practical strategies, tailored action plans to help them with sustainable routines, social support, community help, all that sort of thing. They should have it not just while they're taking the drug, but also for 2 years afterwards. Now, I don't know about you, but what NICE is describing sounds an awful lot like a community slimming group to me.
Yeah, no, absolutely. I mean, I think a lot of people listening, and including myself, that one of the challenges is in weight reduction is obviously maintaining it. Once you get to the goal, then maintain that sort of that weight can be a challenge. If you've got the right people around you, supporting you, who are on your team, so to speak, it's great. But it's not always easy, Doctor, to get that. It's to find the social group. It's not always easy to find people who are going to support you in certain. They may not. I'm not saying they deliberately, but they may not have that as a priority. But in terms of your experience, Kim, it's quite an interesting story yourself. You had a strong motivation there, but having had the motivation, what helped you? I mean, we understand, obviously, I think, we can't emphasize how important having a group support is.
Absolutely.
But for yourself, yeah.
I joined Slimming World 3.5 years ago. I'd been a previous member, but I did have a big motivation in that I was on the verge of having a massive heart attack one day. And I've gone on and lost 10 stone, 4.5 pounds with Slimming World. And it was definitely the group, staying to group every single week. And I still go to group every week now. And it was the support I got from group. It was on the weeks where I was really, really struggling. I really needed the group, and on the weeks that I was doing really, really well, then obviously it was great because you could go and help the other people that maybe wasn't doing as well. But I'd had a really toxic relationship with food since I was probably about 16-year-old. And what Slimming World taught me, being in a group, was that all the foods that I really, really enjoy, that was okay. I can still have all those foods. I have them in moderation and within the plan. So I still enjoy a Mars bar, I still enjoy pizza, I still enjoy chips. I just learned how to cook them differently. And being in the group taught me all of that. It taught me new ways to cook, new ways to think about what I was eating, my mindset, and massively helped me change all my habits towards food. It's been great. I recommend it highly enough.
Yeah, no, it's inspiring how you did that, and I think that the thing is, Kim, one of the things is we live in an age where there's a lot of information that's accessible, and it can be quite daunting sometimes. It's sort of like, we can go online and there's so much information out there. Some of it's contradictory, what you should eat, what you shouldn't eat type thing, and this is what you should do, and so on and so forth. And obviously maybe a different experience for you, but I'm sure a lot of people sort of listening have had that experience where there's so much information out there. It can be, mind-boggling where to start. I suppose I'll direct this sort of question to yourself, Doctor. So, the digital age, there's so much information out there. What can we do? And that was an interesting point there by Kim, because, when I sort of see things on the internet, sometimes there'll be one person who'll say one diet, one the other type thing. And I must admit, personally, anecdotally, I found something that works for me, like in moderation type thing. It's not always easy to stay with that sort of plan, but what's your take on that, Doctor? How can people sort of avoid the misinformation sort of that's out there?
So it's very, very difficult. You're absolutely right. My rationale usually is when I'm talking to patients is if something sounds too good to be true, it probably is. That doesn't just apply to diet tips. It applies to most things in life. So, fad diets, as we've seen with the injections, if you don't have the support and you're not getting the overall change, Kim's just described beautifully how she was able to change her relationship with food. She was able to understand the foods that nourished her, and she didn't need to say goodbye forever to the foods that she loved. I have to say, when you said I'm learning to cook it differently, Kim, can't imagine you'd cook a Mars bar differently, but I do know what you mean about the pizza.
Yeah.
But, eating them as a treat now and again, or eating a healthier version of them, and so on. All of those things you can, actually, they're not fads. They're about sustainable changes. So I would say, go on to the NHS website, look at sites which belong to charities or belong to universities, because they will be reputable. And of course, for instance, the Slimming World website has got a world of information which is sensible, it's sustainable. If you look at what their ethos is, that they are in it for the long term. They are there to support people make changes which are healthy and sustainable for the long term. And it's not about just what you're eating, of course, let's not forget. They've also got a physical activity support program, which if you're on weight loss drugs is absolutely key to ensure that you don't lose muscle as well as fat, because then if you put the weight back on again and you just put fat on, then you're going to be in a worse position than you were when you started, when you get back to your original weight. So eating enough protein, ensuring that you're getting physical activity, getting tailored support for you, that's what they are all about. And it may not look terribly sexy, because unfortunately what works in the long term isn't. It's stuff that we've known about for a very long time, but it's just putting it into action.
No, absolutely. And with that sort of, Kim, there might be people sort of listening in thinking, okay, well, they know where there is a Slimming World type thing. They might sort of walk past a sign, for example, outside somewhere, but maybe they're a bit sort of apprehensive to go in. Maybe they might find it a little bit sort of daunting to go in a new environment, sort of new people. Can you sort of give anyone any insight into what it was like for you? Maybe you found it easy to walk in for the first time, but there are people out there might be sort of not comfortable walking in. What could you say to anyone sort of listening in thinking, well, I might go in and check it out to see if it's for me, but I feel a bit nervous sort of going in there?
I think I'd say to anyone, because obviously I'm a consultant as well now, that I think it is the most nerve-wracking thing that anyone does on day one is walking through the door. And I remember my day one, because I'd lost a lot of weight, but then I'd regained double the amount of weight. So I had to go back rejoining even heavier. And it can be daunting, it can be scary, but as soon as you walk through the door, you meet your consultant, it's almost like you've lost a stone straight away, because everyone in that room is in exactly the same position as you. And it really doesn't matter whether you've got 10 stone to lose like I had, or half a stone to lose to feel better. Everyone in that room starts that journey with you, and they're on that journey forever. So I made some of my lifetime long friends now at Slimming World that will be friends forever, that were there on day one when I started, and they made me feel welcome. Every week I was made to feel welcome. It becomes part of your community. You are part of a community. But as I say, everyone in that room is on exactly the same journey. Everyone feels the same way, and everyone has good weeks and bad weeks. So there's no judgment. It really is an amazing place to be.
Now, and you mentioned there, sort of, like we sort of touched on, the food that you still have certain types of food, and do you find that sort of it's a bit more realistic, really, to be able to do that, to have a plan in place that's not really regimented, so to speak, where it's the reality is we are going to want to sort of like go out for a meal or have a pizza or have a fish and chips type thing, and does that sort of help to know you can still do that and not have to sort of be on some sort of unsustainable diet?
Absolutely. And I was offered loads of different options by my GP when I wanted to lose my weight, when I had to lose weight because a lot of health issues. But the most important thing for me was that this time round, I wanted to still enjoy my life. I wanted to know I could still go out with the children, with my family, with my friends. I could still enjoy a takeaway, but ultimately that I needed to make this part of my life forever. And that's what Slimming World, I knew Slimming World could do that. I could still have a takeaway. I had a takeaway right through my whole journey. I've still ate out with family. I've been to family events, and I've still lost weight. And I've done that by going to group and sharing with the group every week what my events were, what was happening. And as part of the group, they help you navigate options of how you can still go out and do all these things and successfully come back the next week and lose weight. So it is a lot of sharing in group. And as I say, because you're in a room full of people that's already been in those situations, they're there with the answers for you.
And for you, Kim, I know the motivation, from what I can understand, was sort of health. But aside from that, as it sort of in terms of your own general well-being within yourself, has it had a big knock-on effect for you? Maybe sort of confidence and other stuff as well, or?
Yeah, I can honestly say that Slimming World absolutely changed my life. And when I look back 3.5 years ago on the pictures, I almost don't recognise that person. So I learned how to smile again. I learned how to like the new me. I'm a better mum, a better daughter, a better colleague to work with. It just totally changed every part of my life. I can now get in the bath without being scared. That's a big thing. I can now walk without being in pain and get up and down the stairs to go to bed instead of having to sleep on the sofa because I was in that much pain. So, it's not just physical, it's mentally, it's emotionally. Totally changed my life. Gave me an extra 20 years, my cardiologist said.
That's brilliant, Kim. That's brilliant, to hear, and it's good to hear that you've sort of achieved the goal and you sort of the knock-on effect as well. And if anyone's sort of listening, thinking, you know what, I think I might give this a go, at least have a look. Is there anywhere they can go? They can maybe sort of like, have a look, any website they can look at, anything like that?
Yeah, so going to the Slimming World website, just www.slimmingworld.co.uk, and it's great on there. You can just type in your postcode, find your nearest group. It's important that you find a group, there will be lots of groups around everybody, but finding a group on the day of the week and a time that suits that person, so that, every single week, just give yourself that 40 minutes in group. So find a group that really fits in with your lifestyle is my biggest tip.
Yeah, no, thanks for sharing your story, Kim, and being open. And I'm sure that there's people listening who'll be inspired by hearing your journey, and long may it continue. And thanks for your time, Dr. Sarah Jarvis. It's been interesting and informative. Have a great day and a great weekend.
Thank you so much. Real